Welcome back to County Connection. For our final segment, we are going to be talking about traumatic brain injuries, both prevention and treatment. And we have an illustrious panel here with us today, a great coalition of folks from around the county. We have Dr. Phil Friedman from the Copper Mountain Medical Clinic. And we have Jen Kagan who is the program coordinator for traumatic brain injuries from St. Anthony Summit Medical Center. And we have Sarah Lopez from Summit County Public Health. So welcome, everybody.
Thank you.
Thank you. Thanks for being here. So in terms of traumatic brain injuries, it seems like we're hearing a lot about this topic, maybe this time of the year because it's playoff football season. But let's talk about the prevalence. How common are traumatic brain injuries, I guess, both in the big picture as well as here locally?
Well, I would say that we see head injuries frequently in the ER at Summit Medical Center and also at the clinics. I would say approximately probably per ski season we might see 200 plus head injuries at each of the clinics. And last year in the ER for the 2013-14 ski season, we saw over 650 head injuries.
Wow.
So that's quite a lot for a little community.
Right. And how does that compare to other communities? Do we have a sense of that, or?
Well, I know that I think that head injuries are the #1 injury in Summit County, I believe. And as far as prevalence to others, it's been reported that Summit County has 17 times more traumatic brain injuries per capita than the national average.
Wow. So that is a pretty significant figure. So let's maybe back up and talk a little bit about vocabulary. So what constitutes a traumatic brain injury? Is that the same as a head injury? Is that the same as a concussion? How about if we define some of these terms for folks?
Those terms you just used are pretty much synonymous. Traumatic brain injury, most of which we see here are mild traumatic brain injuries that go by the initials MTBI. Concussion, head injury, they all essentially mean the same thing.
Okay.
Caused by any alteration of the movement of the brain within the skull. That's what causes the head injuries. So if the head stops and what happens is the head stops and the brain continues to move, that's the basis of most head injuries.
Okay, and so what are some of the symptoms that you typically see with a TBI?
We see lots of TBIs. The most common symptom is that people recognize is an alteration in the level of consciousness and awareness. Frequently people have a compromise in their short-term memory. They'll very often ask you the same question over and over. They have symptoms, the most common of which is a headache. They may have nausea, vomiting. We actually have an entire symptom scale that goes over about 28 different things that we evaluate when people have a concussion. Most of the ones we see here are mild and the patient continues to communicate with you and they don't require imaging, for example.
Okay.
There's I think a mistaken belief that you have a CAT scan to diagnose a concussion. A concussion is an injury to the chemistry of the brain and to the tissue of the brain, and it doesn't show up on a CAT scan. The only reason to have a CAT scan is if you're worried that there's an additional problem within the skull, specifically bleeding.
Oh, okay. So then you could really seek medical attention and be able to diagnose a traumatic brain injury right away.
Right, and most people, their friends know it. The chap is not making sense, or they have a modified ability to function, and they say something's wrong. This fellow hit his head and he's not the same. That fellow has a concussion.
Okay, and so what would, if you did hit your head pretty hard, or you suspect that you might have a concussion, then what steps do you need to take?
We think that people with a concussion should see a medical professional. In the high schools, they have an elaborate program to screen for concussions. If one of the athletes appears to have a concussion, the trainer or the coach is carefully trained to recognize these. The individual is pulled from the sport and is not allowed to return by law until they've been cleared by a health professional. That's a relatively new law. If you have one, you should be evaluated by a physician. There are all sorts of different grades of concussion. Some are severe, and some actually do require further involvement in terms of imaging to be sure it's not just a concussion, not simply a concussion, but also some other injury to the brain that might require some intervention, such as a bleed.
Okay, so if I were out on the slopes and I took a spill and hit my head, at what point, what would be some signals to me that I should seek medical attention versus head straight to the bar or head home for the day?
Well, one thing I'd like to say about concussions is just like every person's brain is unique to that person, so are concussions. There are similar symptoms that you would expect to see. You don't need to be knocked unconscious to sustain a concussion, and you can still get a concussion with a helmet. You can get hopefully a much lesser injury if you are wearing a helmet as protection. But common symptoms, like Dr. Friedman mentioned, are headache, nausea, some vomiting. You might not have a recall of the event of what happened. If you're skiing with your friend, you might find your friend is repetitive, repeating same questions. They may seem disoriented or confused. But we encourage people to seek medical attention after having some sort of a traumatic event to the head, because symptoms can also come up later on. You may be asymptomatic at the time, but later that night, the next day, even weeks later, people can have sort of residual symptoms.
Gotcha. All right. And so if you do end up seeking medical attention and it turns out that you do have a concussion, maybe it's serious, then what's the treatment? What do you need to be doing from that point forward?
Surely. The serious concussions usually require hospitalization. If the patient is unconscious, for example, they'll very often need the intervention of a neurosurgeon, or at least the evaluation of a neurosurgeon, and they may have to be transferred even as far away as Denver because there aren't neurosurgeons locally available. The vast majority of concussions in Summit County can be managed at the Summit Medical Center. And if the patient is not too severely injured, and this is over 95% of all the concussions we see, they go home with their family with elaborate instructions on follow-up care. And I can't emphasize enough how important that is. The thing I think we've missed historically in concussion management was not getting follow-up care. And I spend a huge amount of time with patients. We have literature that we give them. While we're observing them, as a general rule, we observe people for 2 hours. As long as they are improving in a 2-hour period, they usually get to go home if they have a responsible caregiver.
Okay.
And during this time, we have the caregiver review all the literature we have, and then they have a chance to ask us before they take the patient home. All
right. And then, Jen, you do some follow-up or manage the follow-up with some patients once they head out the door. Is that right?
Yeah, we try at the clinics and in the emergency department to discharge the patient home with some helpful information and sort of a symptom charting tool to keep track of their symptoms over the next 2 weeks. So we provide the patient with some education about how to rest and decrease stimulation. And then in about a week or so, I try, and some of the other nurses at the hospital and clinics do, we try and follow up with these patients or the family member of the patient and see how they're doing, and sort of re-emphasize the need for rest and decreasing stimulation and having a follow-up visit before returning back to your full activities. I just think in the past we've always sort of brushed concussions off, and if you're feeling okay, no big deal, you can go back to your full activity. But it's really important to rest, and it's really important to have follow-up care afterwards.
Great. And so we've talked about treatment. How about prevention? So what are some ways available that we can not get into these situations in the first place?
Sarah, do you want to address some prevention?
Yeah, so there's a lot of wonderful resources in Summit County, and we have a lot of really wonderful collaborations and partnerships, and so education, I think, is a really important part of prevention, and the work that the community is doing, Jen's doing, Dr. Friedman's doing, is very important. And I think it's important to note, we were discussing earlier that just because you're wearing a helmet doesn't mean that you can't get a concussion, that you can't get hurt. So really the first line of defense is making good decisions in that individual. And then certainly always encouraging helmet use because, and Dr. Friedman, I think you would agree that it would be decreasing, the injury, and maybe you could speak to that a little bit.
There's a question of whether, a recent question has come up, is do helmets prevent concussions? And I think most folks agree the answer to that's no, but I can assure you that they certainly reduce the severity of the concussion, so that if you do strike your head or if you have a concussion, it's going to be generally much easier to treat, and you will return to your activity much quicker than if you have a head injury and you're not wearing a helmet. So we really push helmet use.
Okay, but then certainly keeping in mind that it's not going to make you invincible.
That's
Absolutely.
correct. And
Yeah.
I think Sarah really hit the nail on the head when she said, make good decisions. And if people just think for a second, should I be skiing rapidly through the trees?
Right.
Maybe not. All right. So Sarah, this is one of Summit County Public Health's priorities in
Yes.
terms of health issues in the community. Is that right?
Absolutely, and the reason why it is that we have Colorado sets winnable battles every year, and or not every year, but usually it's a 5-year cycle, and so they will set these goals, and every 5 years we, as a community, kind of come up with our priorities and our needs. And one of Colorado winnable battles is injury prevention. And in our community, certainly traumatic brain injury is an issue for this community, just because, and it's not just the skiing, it's, people are going out, they're riding their bikes, they're out on the lake, they're, all the outdoor activities that everybody likes to do here. We do get a fair share, as the numbers show us. So
absolutely. All right,
Yes.
great. So what educational resources are available for folks who want to learn more about the prevention, or if they happen to have suffered a TBI themselves or know someone? Where are some resources that folks can find that info?
Well, in the community, we have a new TBI program at Summit Medical Center, and they certainly can contact me at the hospital, and I can help sort of navigate them through finding resources, finding follow-up care. We have a very active nonprofit group in the community called Think First, which is a brain and spinal cord injury prevention program. They go into the schools, they go to the ski areas, they have events in the summertime where they're giving away helmets, providing education to children and their families about preventing these types of injuries. Sarah can speak to some other preventative groups.
As Jen mentioned, the Think First, and they've done over 100 presentations in local schools, and they've given away over 1,000 helmets, so it's really
that's
great
fabulous.
success. And I think, Jen's role, which is new at St. Anthony Summit Medical Center, is just going to be a huge asset to the community in terms of coordinating. As these guys have mentioned, these injuries, they linger and they can last for a very long time. So I think intervening early, making sure that people are getting followed up medically, and then also just having someone check in and making sure that things aren't worsening, and then providing those community resources and support for the families is extremely important. So we're very lucky to have Jen in our community and serving our population.
Some other broader resources, there's the Brain Injury Alliance of Colorado, pronounced BIAC, and they have a very informative website. Also, the CDC website has a lot of information online. There's a lot of information out there recently and in the media related to head injuries, so I'm hoping that it's becoming more easily accessible to people who want to inform themselves or learn more about head injuries.
Right, and I would think parents would be real interested in this kind of information too, as their kids are involved in sports or just, like Sarah said, engaging in all the great outdoor activities that we have here in Summit County.
Right.
All right. Well, do any of you have anything that you'd like to add on the topic, or have we pretty much covered everything?
Well, one thing I would like to add to our local resources is that Summit Medical Center has 2 support groups for traumatic brain injury survivors. And one is geared towards adolescents, young adults, and the other is an adult support group. And right now, I believe they're meeting once a month, and you can contact the hospital for further information if you're interested in those support groups. But it brings together local people in the community who may have suffered a similar injury to kind of help their healing process together.
Great. All right. And Dr. Friedman, what would you say if you were to boil this whole topic down to one takeaway message? What would that be?
If I could give one takeaway message, it would be follow-up is critical, and the best person to follow you up is your primary care physician. If you don't have a primary care physician, then you can call Jen at the Head Injury Committee, the Head Injury Program at the hospital, and she'll refer you to some physicians in the community that are interested in head injuries.
Mm-hmm.
Fabulous. And Jen, what number is that folks should call if they're interested?
970-668-6121.
All right. Well, thanks very much, everybody. It's great to have such an esteemed group of folks here who are doing such important work in the community. And thanks so much to those of you at home who have joined us for this episode of County Connection. We will see you next month.